Alright guys, welcome back. Today we're going to be going over hip palpation. So there are a total of 6 different palpations that we'll do. We'll do long axis distraction, internal and external rotation, A to P and P to A, and then an S to I and flexion. So to start, we'll use long axis distraction. When we make our contact with long axis distraction, we're going to use a leg stabilization, kind of like we did with the knee. But what we're going to do is let that leg stabilization be at the distal femur. So as I bring my patient's leg out, I'm going to have that contact on the distal femur here with my knees. With my patient's permission, I'm going to palpate up here at the femur, and as I distract, I'm going to feel for distraction of that femoral head and the acetabulum. We can then shift to internal and external rotation. When we start with internal rotation, we are looking for about 30 degrees of passive internal rotation. So as I bring that foot out, one thing we need to look for here is our patient's hip starting to hike or shoot forward. That tells me that I've run out of hip internal rotation, and now I'm starting to get a pelvis rotation in there now. So I'm looking for about 30 degrees of hip internal rotation and then 40 degrees of hip external rotation. The next thing we're going to do is we're going to tell our patient, I'm going to contact right here, is that okay? And with their permission, what we're going to do is contact the posterior aspect of that ilium, the anterior aspect of that proximal femur. Notice that my fingers are out. I'm not putting my fingers in for obvious reasons, I hope. So we're going to contact that ilium here and contact and push straight anterior to posterior. We're going to skip P to A real quick, but we're going to do S to I inflection. S to I inflection, we're going to bring the knee up here and we're going to contact that proximal femur again, but we need to make sure that we've established a barrier with our patient. Our patient knows what we're getting ready to go do. Rather than just jumping in and doing this palpation. Patient, I'm going to be contacting you here on your, up here on your upper thigh. Is that okay? And with my patient's permission,
yes.
Yes. So with my patient's permission, we'll establish that contact. So I'm actually going to have my patient guard. I'm going to grab this contact here. Notice I brought her leg out, being very deliberate of my contact. And I'm going to interlace my fingers here. And then it's just simply a challenge, S to I. The last palpation then is a P to A, so I'm going to ask you to roll over onto your stomach, please. Again, here we need to tell our patient what we're doing. Patient, I'm going to be touching you kind of here in your low back and in your butt, and then I'm going to be grabbing around into the front. Is that okay?
Yes.
So we contact here, right? And I'm going to, again, fingers are out. I'm going to be pushing P to A, assessing for a little bit of a glide of that femur and the acetabulum. So that is the hip palpation. Long axis distraction, internal and external rotation, A to P, P to A palp, and then an S to I inflection.